This idea of psychological suffering we could break down into two different categories. The first is psychological distress. These are pretty normal reactions that people might have, feeling anxious before giving a talk, getting upset at times, just going through an array of emotions that are within normal limits. They don't cause significant problems, they come, they go, but generally we can keep ourselves intact. That is something we might call psychological distress. More of a reaction that's within expectation to the situation and the context. Psychological suffering, however, takes things a little bit deeper. This is where, especially in scientific domains, we define psychological suffering as clinically significant distress in a number of areas of functioning, typically social or occupational. And psychological suffering here is usually within the realm of clinical disorders. Anxiety disorders, depressive disorders, trauma and stressor related disorders. There's many different categories, but pretty much all of them, when you look through the DSM, the Diagnostic and Statistical Manual for Mental Disorders, you will see that common piece. If somebody has hallmark symptoms, however they don't have that clinically significant distress piece, we actually can't make the diagnosis appropriately. Now, this is relevant because both of these areas are things that can be experienced in our lives within the psychological domain. However, for psychological distress, we usually develop our own ways to deal with these problems. Emotion regulation strategies, meditative approaches, sometimes medications. Those typically aren't necessary for psychological distress, but they can help in certain situations. Now, for psychological suffering, that's where things get a little bit more nuanced. Oftentimes, we are looking at medication approaches and or therapy approaches to help deal with that clinically significant area of impacted functioning. Now, this is great for dealing with clinical disorders or however you want to define them, whether or not you agree with the symptom-based approaches within the DSM or whether you think things boil down a little bit more to psychological mechanisms of action that can be functional or dysfunctional based contextually on what's going on. It really doesn't matter in that sense. Both are focused on dealing with underlying problems that cause that clinically significant distress piece. Now, again, those are great for clinical disorders. However, we also find, and this was certainly the case for me working as a therapist, providing acceptance and commitment therapy among other approaches. ACT was my main modality and my main approach. But I often found that I was able to improve symptoms and I was able to help patients deal with the problems that they came with. However, there were oftentimes deeper issues that we just could not touch on sufficiently. We certainly could touch on them, but I wouldn't say we could really treat them. Maybe perhaps they're not even treatable issues, but they're still very relevant to someone's life. We might cluster these more so into the existential categories, right? Dealing with birth, aging, death, disease, decay of the body, all those different issues. You could deal with those in therapy to some extent. However, if you've actually worked as a therapist, you'll find that the level of depth you can go into, it's oftentimes limited, especially if you have to work within insurance companies, but that's a whole other topic to deal with. Those existential issues, I wasn't able to find satisfactory answers within clinical psychology literatures, not just for myself, but also for treating patients. We saw lots of improvements in terms of dealing with the mind and its different domains, right? Language, emotions, thoughts, behaviors, all those different things. Therapies like ACT, they do a great job dealing with them. However, some of the deeper issues, I was working with military populations, we couldn't really do anything about it, right? Their lifestyle circumstance, having to deal with certain hardships here. You can give all the therapy you want, but if they're in a deployment setting and they're stuck in that environment and that environment is causing the issues, you can make some progress, but you aren't going to get super far there. So when you start to get into things that are a little bit more unavoidable, realities of life, whether it's situational or just a fact of life in and of itself, That's where we start to see issues with a lot of these approaches, therapies, medications, both, however you want to categorize them. Now, what I found in terms of approaches was that other domains, other literatures had certain answers that we just couldn't find in science. Science is really good at taking a narrower scope, like, hey, we're going to look in the lens of the mind, and we're going to look at all the different neuropsychological functions, behavioral functions, whatever you want to call them, and then we're going to determine how to come up with specific, detailed approaches there. Science is really good at that, but these broader issues at play, we still don't really have answers there. But when you look in spiritual literatures, for example, you do see a lot more approaches, a lot more, I would say, broader scope or holistic approaches to deal with these problems. That's where the psychology of awakening comes in. When we're going beyond just issues with the mind, issues in our day-to-day lives, and we're starting to look at some of these broader questions and how to deal with them, that's when we start to look more at the psychology of awakening. You aren't going to find solutions to these issues when you take medications. Reducing anxiety is typically, well, I would say it's always not enough to answer these questions, but they can help with short-term distress. So in terms of dealing with some of these existential issues, again, death, disease, aging, birth, decay of the body, all those different categories, there's typically two main areas that we need to address. The first is having incorrect knowledge, and the second is having an incorrect set of practices regarding how to deal with these issues. Going back to what I said earlier, if we try to take therapy or medications and apply those heavily to something that can't be treated, in the same sense that anxiety disorders can be treated by therapy or medications, we try to deal with a different set of problems, we aren't going to see that much in terms of success, right? You can spin this the other way around. If you're trying to take certain holistic approaches and someone has a broken arm, yeah, maybe you could help them psychologically with it, but really what they need is to have their arm fixed, right? They need to be in a cast, they may need surgery. You got to match the problem to the solution, okay? And the psychology of awakening here is getting at some of those deeper questions. Now, what we will find is that with appropriate practices and correct knowledge, there are some very, very significant mental health benefits that come through, and those can help with clinical disorders. But that's not the underlying purpose for these approaches, the psychology of awakening. It's just more of a beneficial outcome that tends to come with realization, correct practice, and correct knowledge.